Infection Control Part 1. So the introduction, patient care must begin and end with proper hygiene. Inadequate hand hygiene can lead to the spread of disease. Adequate and effective hand hygiene reduces the transmission and lessens the severity of disease in a patient. Most microorganisms are not harmful. However, there are some pathogenic microorganisms which do cause disease. Any sustained harmful alteration of normal structure, function, or metabolism of an organism or a cell is considered a disease. This can be either a genetic disease, drug-induced disease, autoimmune disease, degenerative, communicable, or infectious disease. An infectious disease is considered a disease that is caused by growth of a pathogenic microorganism. An uninfected person or a carrier can transmit infection to another person. A lot of times, this is our healthcare workers, if proper hand hygiene is not done. Antimicrobial growth requirements. So pathogens require certain growth requirements. The first is nutrients. In order to survive, they like moisture. They like temperature around a human's body temperature. So 98.6 is their preferred temperature. Oxygen, most pathogens are aerobic, meaning they need oxygen in order to survive, but there are a few that are anaerobic that do not need oxygen in order to survive, and in most cases those organisms are killed by oxygen. Neutral pH, most prefer pH around 7, so acidic pH is a 1, and our more alkaline is above 7, so 8 to 14. The medical assistant should try to eliminate as many of these growth requirements as possible in order to enable growth. So the chain of infection, you will have a worksheet that you should fill out and study from for the chain infection. So the first step in the chain is the infectious agent, and then it goes to the reservoir host, so whoever is carrying it. It then exits that host through the portal of exit, and then it goes to the mode of transmission, so how is it transmitted, to the portal of entry, and then to a susceptible host. And we will talk about these much more in depth in this PowerPoint presentation. Not all microorganisms are pathogenic. Pathogenic meaning disease-causing. Normal flora, meaning non-disease-causing microorganisms, present to help the body function. A good example of this is E. coli in the digestive tract. There are 5 types of infectious agents. Those infectious agents are viruses, bacteria, fungus, protozoa, and Rickettsiae, which we will talk about more in depth in the following slides. Viruses are intracellular parasites that take over the DNA or the RNA of an invaded cell. Interferons produced by cells to help protect cells from viruses. And the treatment is palliative. Why do antibiotics not work for viruses? Antibiotics destroy bacteria outside of a cell. Viruses typically inhabit or invade the inside of a cell, so that antibiotic cannot attack that virus. So viral infections are usually defeated by destroying the host cells. There are some antiviral medications out there that are used for viral type infections, such as Relenza or Tamiflu for some of the influenza type infections. But our best line of defense is our vaccines. For many viral illnesses, we have vaccines used in prevention of these types of diseases. So we have vaccines for hepatitis A, hepatitis B, polio, measles, mumps, and rubella. There are a lot of vaccines out there that we use to prevent viruses. The only virus that is out there that we do not have a vaccine currently for is hepatitis C. There are some medications that lessen the severity and slow down the progression of the disease, but we don't have a vaccine. Bacteria are tiny, simple cells that produce diseases in a variety of ways. They are classified according to their shape and morphology, which is different from viruses. Some bacteria can produce resistant internal structures called spores. Those spores have a different kind of treatment and oftentimes need dual antibiotic therapy. Bacterial infections are treated with antibiotics, and there are a variety of antibiotics out there. And depending on the classification based on shape and morphology will depend on which antibiotic is appropriate. Antibiotic resistance. Resistance occurs when an antibiotic is used inappropriately to treat an infection. This oftentimes happens when an antibiotic therapy is prescribed when it's not warranted. So it's important to only prescribe these medications when it would benefit the patient. Treat the patient with an antibiotic that is specific to the infecting pathogen. And then prescribe the recommended dose and treatment duration of the medication. So accurate dosing, so not a decreased dose or fewer days of the dose. This might cause resistance in that infection. And then sometimes what can happen is patients will not take the medication as prescribed, and this can develop antibiotic resistance. Protozoa are unicellular parasites that can replicate and multiply rapidly once inside the host, frequently are seen in tropical climates. Examples are malaria, which is spread by a mosquito, gardaesis, which is spread by ingested fecal matter, typically from a water source. And then another one that is on here is Trichomonas vaginalis, which is spread by sexually transmitted diseases. Fungi include such organisms as mushrooms, molds, and yeast. They grow best in warm, moist environments. Treatment is with antifungal agents, for example, monostat, diflucan, Lamisil, ketoconazole, Lotrimin are all examples of antifungal agents. When I talk about fungal diseases, some examples are ringworm, yeast infections from candidiasis, and jock itch is another good one. What is the medical term for fungal infections? That would be a mycotic infection. Rickettsiae, microorganisms that have characteristics of both bacteria and viruses. They obligate parasites that must live within a host cell for growth. They are larger than viruses, so they can be viewed with a microscope. They can be treated with antibiotics and usually transmitted by a vector such as a tick, mite, or flea. Some examples of this type of infectious agent, some of the diseases are Rocky Mountain spotted fever, which is caused by a tick, and also Lyme's disease, which is caused by ticks. Reservoirs are the second link in the chain of infection. May be people, insects, animals, water, food, or contaminated instruments. Must gain entrance into a host or else they will die. Reservoir hosts supply nutrition for organisms, allowing it to multiply. So sometimes a reservoir will have a pathogen that will cause the infection themselves, and they will become infected, and then they will carry it to somebody else. Or they might not necessarily have that illness, and they will have a vector-borne disease and they will carry it, but not necessarily show the symptoms. And they can infect someone else. Portal of exit, how do pathogens escape reservoir hosts? So mouth, nose, ears, eyes, intestines, urinary tract, reproductive tract, and open wounds. Anything that's open on the body is the portal of exit. Use standard precautions. Some standard precautions that we might use are wearing gloves, wearing a gown, wearing a mask, washing hands are all really good standard precautions to help control the spread of infectious diseases. If you had a patient that was really contagious, maybe, for example, a patient with tuberculosis, we will want to isolate that patient also. As soon as possible, we would want to wear our PPE, so a mask, gloves, gown, and then we would also want the patient to wear a mask, especially in those highly contagious states. Transmission. So direct transmission occurs from contact with infected person or discharges from infected person. Indirect transmission occurs from droplets in the air expelled by coughing, speaking, or sneezing. Vectors that harbor pathogens, contaminated food or drinks, and contact with contaminated objects called fomites. So what helps control transmissions? Proper sanitization, use of sanitization, disinfection, and sterilization, and also the use of germicides such as Cidex. Portal of entry, how transmitted pathogens gain entry into a new host? By mouth, nose, eyes, intestines, urinary tract, reproductive system, or an open wound, so anything open in the body. Anatomic defenses include the integumentary system, sore skin, tears, cilia, mucous membranes, and the pH of our body fluids. So our vaginal secretions in women are of higher pH, and that is on purpose to eliminate some of those pathogenic microorganisms from entering the body. Our second line of defense is our immune system and the inflammatory process. We have humoral immunity and cell-mediated immunity. Humoral immunity is the immune system's response by producing antibodies specifically designed to combat the presence of foreign substances or antigens. Our humoral immunity is basically they activate the B-type cells in our immune system. The cell-mediated immunity is the immune system also reacts to cellular level with T cell activity by causing destruction of pathogenic cells at the site of infection, also called phagocytosis. The inflammatory response, this is a graph of how our inflammatory response starts and how it trickles down. Our inflammatory response occurs when there's a trauma to the body. So this could be a simple infection, it could be a car accident, it could be anything that invades or is stress to the body. The four main symptoms of the inflammatory response are redness, swelling, heat, and pain. The inflammatory response, inflammation meteors are released and cause three different responses at the cellular level. So blood vessels at the site of dilation, release of white blood cells to the site, which when white blood cells are increased, that causes phagocytosis, which phagocytosis engulfs the pathogen and destroys the cell. Chemostaxis is the release of chemical agents occurs attracting even more white blood cells to the site. So a lot of times when there is a foreign invader, histamine is a common chemotaxis that is released in our body to get more help to that site. If a body is too weak to fight off infection, a systemic infection meaning the bloodstream, occurs and is called septicemia. This type of infection can be very, very deadly if not treated immediately. Acute infections are rapid onset of symptoms that last a relatively short time. Prodromal period is the time when the patient first shows vague, nonspecific symptoms of the disease. Symptoms appear after the tissue damage begins. Oftentimes, viruses take about 2 to 3 weeks to totally be eliminated, but this is still considered an acute infection. A good example of this would be the common cold. Chronic infections persist for long periods of time, sometimes for life. Some chronic infections are asymptomatic, meaning they have no symptoms at all, but a virus is transmittable. A good example of this is hepatitis B. Hepatitis B can lay dormant for long periods of time before showing symptoms or take effect. Hepatitis B is also very agile. It doesn't die easily. It can remain on surfaces and on a person's hands for a long period of time. That's why it's important for proper asepsis and wearing PPE to eliminate the possibility of those bloodborne pathogens entering the body. Latent infections are persistent infections in which symptoms cycle through a period of relapse and remission. Examples include cold sores, genital herpes, and varicella. So varicella meaning shingles. It can relapse once you have the chicken pox. It lays dormant in your nerves and it can relapse later on in life, which is then called shingles. Herpes is another one that can relapse and go into remission in the cycle. Usually relapse occurs when there is a stressful time in a person's life. Opportunistic infections caused by organisms not typically pathogenic but occurs in hosts with an impaired immune system response. Examples are HIV. The incubation period for HIV can be up to 10 years. So opportunistic infections, meaning a person with HIV has a weak immune system and they then become infected with another disease such as pneumonia or oral yeast infections, that sort of thing. These infections are not typically seen in healthy people, but since the immune system is compromised, they are more likely to occur in people who have HIV.